Hello, I'm Anita Davis, and I have with me a special guest, Dr. Winston Carhee. Thank you for taking time out your busy schedule to be here today. My viewers and I would like to know of your background and what your company stands for.
Yes, well, my background is I am a doctor of chiropractic, and I own and operate Pain and Wellness Center located here in the city of South Fulton, Southwest Atlanta. And basically, we stand for natural health care, and we want to make sure that anybody that we treat has 100% excellent customer service, and that we're doing the best thing to help them heal naturally.
Awesome. How do you identify sensitive pressure points?
Well, pressure points are typically what we call scar tissue. And scar tissue is when tissue is trying to heal, it is layering on top of the tissue that it's trying to replace, but it has more nerves. And a skilled practitioner will be able to find these areas that are layered, and they would take the area and smooth it out and make sure that the tissue now is moving along the natural movement pattern of the tissue it's trying to replace. It takes somebody with skill and training to locate these pressure points, but we do it very well here in our offices.
Sounds real good. So, what sparked your interest to be a chiropractor?
Well, early on, I always knew I wanted to pick a profession that helped people. And in school, I was around a lot of professionals, and I was able to see how they live their lifestyle. So, one thing that really changed my life was I was involved in a major, fatal accident when I was 16 years old, and two of my friends perished in an accident. So I had to undergo a year-long recovery. So I really appreciated those people who helped me through that recovery. And so I wanted to maybe be like a doctor or maybe a research scientist, but I wanted to help people without utilizing drugs or surgery. And fortunately, I discovered the profession of chiropractic. And I realized that they had a school here in Metro Atlanta where I live, Life University. And so I decided to go to that university and study the profession of chiropractic, which proved to be the best decision I ever made.
And how long have you been in this career?
I've been in this career about 16 going on 17 years. And it's been truly a fantastic journey. And I actually work in the area that I was living while I was going to Life University. My parents lived down the street from this practice, and that's where I was when I was going to school. And I decided to open up in the same location. So now I've been living and working here for greater than 16 years. We live here, we work here, we worship here, and we love the people that we treat. And it's really like a family practice. And so I really appreciate that aspect of it.
Yes, I definitely felt like a family when I started my therapy sessions with you guys. And when did you decide to establish your own firm?
Well, I sort of knew I wanted to have my own practice right out the gate because I grew up around, black professionals, and I realized I wanted to have my own type of practice. However, I worked for another practice for about 3 months in Doraville until I was able to establish my own practice. And I started slowly, and I naturally grew this practice, and I've been here for 16 years. I was across the street naturally. It was a building. I used to be Promenade Park there for 13 years, and I was blessed 3 years ago to purchase a building right here on Cascade Road in Southwest Atlanta. So I've been here on this building for 3 years in the same area.
I am ecstatic of my improvement after my sessions. What are your methods?
Well, I can't give you all the secret sauce, but what we do is, in fact, based on science. I happen to be on the board of the Clinical Compass, which actually uses research and evidence, and they help improve the practice in the chiropractic community. So I base all of my techniques and strategies are based on science, and we use the latest science to provide the clinical outcomes that we want. And we use evidence-based clinical reasoning to make sure we're providing the best service. And this is all based on how your body tissues heal. We call them the 3 phases of healing. So we tailor each care plan for each individual injury, for each individual person, and to make sure we're giving the best treatment for that particular phase that their body is in during the recovery process to help them fully recover.
Wow, that is very, very educational. As a company, what do you incorporate that makes you relate with your patients?
Well, it's easy when you understand, you know, and you like the people you treat. So I tell all of my employees, you should love what you do. So I think love is the difference, right? They should love helping people, number one. If they truly care about the people that they're treating, then they'll go over and above what it requires to make sure they're providing the best service possible. And so we stand by that. And I stand by that in my treatment. So I really get to understand the individual and know what exactly is ailing them. And they're able better to communicate with me. And I'm able to communicate with them so that we can tell them the exact thing they need to be doing to help them. And we can give them the best care possible. So I think that sort of makes the difference.
Absolutely, absolutely. And with your patients, what are your major areas of complaints?
Well, we specialize in treating motor vehicle collisions. So, of course, the whiplash injury or the cervical acceleration, deceleration injury is common. However, in automobile accidents, everyone should be wearing a seatbelt. So oftentimes, the seatbelt shoulder harness injures the shoulder. All right. Then we have some individuals who are seeing the impact coming and they sort of brace themselves and they slam their feet into the floorboard upon impact, causing injury to their ankles, their knees, and their hips. So we treat all injuries, all areas of the body, but we are able to find out exactly what's ailing them and give them the best care possible, depending upon what type of injury they present with.
Mm-hmm. And lastly, what are your certifications?
Wow, I'm certified by the Ligament Injury Institute in injury severity thresholds, including but not limited to alteration of motion segment integrity, and we are certified in mild traumatic brain injury, uncinate process fractures, which are upward lateral projections on the vertebrae that fracture during auto accident collisions, and then we do a lot of vertebral basilar artery insufficiency, among post-traumatic stress, which is really big now. The leading cause of post-traumatic stress is actually auto accidents. It was wartime trauma, but that's changed. And then we do a lot of other type of diagnoses of things that may go missed in some cases. But most importantly, we understand how to diagnose, right, the accident-related trauma injuries as they relate to the head and neck. And we also understand the American Medical Association diagnoses of accident-related trauma injuries and how they relate to injuries of the head and neck.
So, Dr. Carhee, how can people get in contact with you?
Well, number one, they can go to the internet and www.pain2wellness.com. But they can also find us on Facebook, Pain to Wellness on Facebook. And we're also on Twitter, Dr. Carhee. I think it's at Dr. Carhee. And we have several other outlets. So Google Dr. Carhee. That's the best way to find me.
Okay. Thank you, Dr. Carhee, for all that information.
Well, thank you. It was my pleasure to give it. Thank you.
And speaking on my personal experience at Pain to Wellness, I had an accident around July, so it was July 4th, and I found out of this chiropractic location through my attorney. And since the day I've been coming for my sessions here, they have showed how their empathy, and I have definitely, my pain level has reduced. I came in at a 10, and once my sessions were over, I left at almost a 1. It was almost a 0. They definitely show empathy, and that was what got me. And this is Atlanta's best chiropractor. Thank you very much. I'm Anita Davis, and have a good day.